Welcome, everybody. My name is Kat Mathewson. I'm the Development Director at ShelterCare. So today we have 5 different staff members with us who are going to answer the questions you sent in. And this is in celebration of our 50th anniversary, which is officially on Christmas Eve. We were founded in 1970 on Christmas Eve as Eugene Emergency Housing. And at that time, we only served 4 families. And we were located in the old Delta house of Animal House, the big party house on the movie. So we have all your questions that you submitted at registration. After, the staff members are going to each take a couple minutes to introduce themselves and tell you what they do and about their program. After that, we're going to start with the questions that were submitted at registration. And then if we have time for more questions, you can submit them into the chat box. Go ahead and send them to the host, and I will be reading the questions. No guarantee we'll get to the questions submitted in the chat box, since we are going to start with the ones that were already sent at registration. We're going to go through each staff member now and give them a couple minutes to introduce themselves. We're going to go in alphabetical order. So we're going to start with Chad.
Hi, I'm Chad. I'm a lead housing specialist with Permanent Supported Housing. I specifically work with the Madrone/SPC program. So I work very closely with Homes for Good. And at Permanent Supported Housing, we help unhoused people find and maintain housing. Hopefully helping them secure mainstream benefits and supportive services, all by using a housing first model. Thank you.
Hi, I'm Jessica, and I'm the lead case manager at Short-Term Housing. And as the team lead for short-term housing programs, I provide leadership to 3 team members, and I work with our consumers in our housing programs to provide support and advocacy for their goals. In short-term housing, we have several different programs, and they vary in length from 3 months to 2 years. And our site also has emergency shelter units with temporary shelter ranging from 3 to 6 months. We also have 2 rapid rehousing programs that provide rental assistance for our consumers for up to 2 years. And the goal with rapid rehousing is for our consumers to quickly get into housing in our housing first model, and then to be able to support them, for them to be able to support themselves after they exit our program. We also have one program that connects them to housing choice vouchers with Homes for Good, and that's permanent supported housing for them. And we provide support services for a while until they graduate from our program. I primarily work with our FUSE program, and FUSE stands for Frequent User System Engagement. And what that means is that we work with people who are homeless and frequently use system resources in our community, such as emergency rooms, CAHOOTS, the jails and court systems. And FUSE is a community partnership that's coordinated by Lane County. So most of our FUSE consumers have likely been homeless for a very long time. I think the average is around 7 years. And we help them to overcome the several housing barriers they have to get into housing and to stabilize in housing. And so through the FUSE programs, they are able to reduce their rates of that use of the systems in the community.
Good morning, everyone. My name is Jose, and I'm the Assistant Program Manager for STH, which is SMR and HHW. But I'm currently stationed at SMR and kind of focusing on the day-to-day operations of SMR, where we take in medically fragile clients who are usually unhoused that need somewhere to recuperate. These clients usually come to us from a variety of places, but they usually come from the hospital, they can come from a SNF, or even the street. Basically, it's just somebody who needs to recover for a certain amount of time to ensure that they don't end up back in the hospital. And we usually try to connect them with services. So my role is focused mainly on ensuring that the client needs are met for both sides, for all of our programs, and that we adapt our programs to have a more humane approach. We are a shelter as well, so we do the best we can with the resources we have. And I also get to do a lot of the behind the scenes tasks. So nice to meet y'all.
My name is Nick. I work at Schenkel program, which is a permanent supported housing program. It used to also be the Hand of Outreach through ShelterCare. Right now, we're transferring over to the Martin Luther King Will Commons on MLK program as well, which we'll be working with the Fuse List clients to get them housed. We provide supportive services here, which is we help people maintain and stabilize in housing, achieve greater self-determination, and obtain mainstream benefits that they're eligible for. So those are the things that we like to do here. In general, also just being around to help people understand that some of the skills that they had on the streets don't necessarily help them stay housed. And so we're here to help them figure that out prior to going anywhere where they'll just get evicted for displaying behaviors. Thank you.
Hi, my name is Royana and I work over at the Housing Services for Families. I'm the team lead here and I've been here for just over 3 years now. Our programs here vary. We mostly work with families, sometimes single individuals. And our jobs are basically to help families and our consumers in general become financially stable, maintain housing that they're in at the program's entry, or acquire housing once they're in our programs. We also will help them with getting the resources they need to create long-term support networks and help them refrain from becoming destabilized in the future. Our positions range from a 2-year program, the Mackenzie Rapid Rehousing Program for housing, emergency family shelter units. That's about a 90-day program max. We have our SPURF program that's done through DHS, and that works with people who are dealing with child welfare. And their last things that they need to be doing are getting housing. And we do have some private fund programs. And currently we're working on the CARES COVID relief program, helping people get their rent paid because of the pandemic. So, all of our team, we work really well with the landlords. We have lots of trainings and we have, a lot of hands-on experience with helping our consumers navigate through the landlord system and get their needs met with their housing, but also, just get it into housing because that's a big barrier for our group a lot.
Thank you all. We're really happy you can take the time to be here today. It sounds like you all stay pretty busy on your Monday through Friday and sometimes weekend positions. So the first question we have looks like it's for Jose. Can you tell us, how do people end up at SMR and what do they bring with them?
Yeah, of course. So usually we work on a referral-based system. We have 3 current funders right now. Okay, technically we're going to have 4 funders. We are starting a new ESG grant for COVID relief beds. But typically, normally we have 3 funders. One is PackSource, one is Trillium, and the other one is Peace Health. And so if clients have PackSource or Trillium, a referral can be made to their insurance company for funds. Once that happens, a referral can be made to our program. We'll kind of go over the client's case, see if they'd be a good fit, successful here. We'll kind of talk to them, explain kind of our program rules and expectations. And the same thing with Peace Health. So if a client doesn't have Trillium or Pacific Source, Peace Health can volunteer to pay for their stay here, and it'll be the same process. They'll do a referral, get them over here. We'll talk to them, let them know what our program is about. The other thing is when clients usually come here, our rooms aren't too big. I don't know if you've ever been to ShelterCare. It used to be an old motel, so the rooms aren't too big. Normally we can fit 2 to 3 clients in the unit, but because of COVID, we're doing 1 client per unit. But still, we usually let clients bring in 2 bags of personal belongings. usually no more than that, and we kind of ask our clients not to accumulate too many things because we are a short-term, shelter, and at the end, they're going to have to. We try to help them discharge to a safe place, but a lot of the times if they accumulate a lot of belongings, it makes it hard to get all their things together and help them transition on.
Thank you. So next question we have is for Chad. How did people get into permanent supported housing?
Well, there are a lot of different ways to get referred to one of our programs. I think maybe the simplest and the way that hits the most of our programs is through the county waiting list, um, which is something that's done by community partners to help us gauge a person's vulnerability on the street. So that's one way. Another way, there we have a partnership with Lane County Behavioral Health. There's also a Fuse program that we go through, and then we have our own internal waiting list that isn't open very often because it's so full.
Thank you.
Mm-hmm.
Okay, here's one for Nick. Can you tell us more about the Commons on MLK? When is that opening and who's going in there?
Yeah, for sure. So the Commons on MLK is opening on January 15th of 2021. So coming up fairly soon. The people that are going into MLK are those that are on the centralized waitlist, like Chad was talking about, which is done through coordinated entry, and then they are brought into Fuse, and that's by a partnership between many the county's agencies. The people that are going in there are deemed the highest vulnerability level, highest needs, because we will have staff 24/7, just there to help them navigate methods. There'll be 51 units. Each unit can actually have up to 2 people as long as they are both in agreement that they should live together and they apply that way. But yeah, so we'll be getting a bunch of people actually off of the centralized waitlist. I think it's a fairly large percentage and proportion of it. So really excited that we can help move that list forward pretty quick.
Rihanna, can you tell us more about the CARES Act money that you guys have been helping with for COVID? What have you guys been doing there?
Yeah, so the way that works is there are ways to sign up through the county. I believe they're opening up another waitlist actually on the 16th of November, and it's going to be first come, first serve until we run out of funding. And the other way is if family or if people/families have contracted COVID, then the county helps them by sending them a link and they fill out the application. And then there's different agencies that are helping. We're one of them, and we'll get a list of names and we call everyone. We have them fill out a couple of forms for us so that we can talk to their landlords, and then we get the landlords to tell us, what's past owed, what their monthly rent is, and then we pay out up to 90 days. Although right now the program is officially ending on December 30th, and so we're allowed to pay through January rent, and that's kind of our stopping point for right now. Currently, we're helping with about $50,000 a week in rent money that we're paying out weekly. So it's a lot, and there's a lot of families that need help, but there is another wait list opening up on the 16th. So if people need it still, then it's a good time to apply.
So here's a question if anyone wants to hop in and help with this one. What supports and resources are there available for housing for people who are stepping down from treatment facilities and into independent or supported housing? And how do they identify and access them?
Can you repeat the question?
Yeah. So what kind of housing is available for people exiting treatment facilities, such as substance use treatment facilities, and how do they access those?
I suppose I could jump in some with what I've known so far. After a treatment facility, there's a couple of options, and it really depends on who they're already working through. I know that there's a few options for families through the Willamette Family Program. They have some housing opportunities, as short-term housing, to find something long-term. There's like the dad's program. There's a few places within our community, but there are also what we call transitional halfway houses. The Oxford houses, there's a few others, and they're not, it's definitely like you're renting a room, and there's rules, but it's not quite in like inpatient treatment. And, they require you to stay clean and sober while you're there. But usually meetings in the community have some access to lists like that. So you could try meetings in the community, or you could try the treatment center you're at and see if they have a list of those houses as well.
Thank you. Do any of you want to speak to services that you provide within shelter care that are not necessarily just housing, and maybe some of those wraparound services?
Yeah. So at permanent supported housing, we're not just, as Katrina said, providing services specifically around housing. A lot of our programs come with a peer support specialist, and they really have the ability to do a lot more of activities with the individual, especially as far as like getting them reconnected to the community. Um, so that could be anything, taking them to some adult classes or to the Y or something like that. And then, we provide rides to the hospital and just give our people general support to access some of those services that might be a little bit, harder to navigate on their own.
Yeah, and I can speak more to this as well. So here, like, housing is kind of the avenue that we navigate down. So everything has to be connected to housing in some way. However, a lot of things actually are connected to housing, and a lot of, I won't say they're behavioral health, but they're kind of similar to behavioral health problems connect to housing. We'll teach people how to do life skills, that is learning how to cook the things they like on a budget that they like. We'll help people navigate what it means to pay rent on time. We'll take people into the community on outings. And there's just a plethora of things that pop up. It's really dependent on each situation, but we try to help people navigate it in a way that it won't affect their housing. And while that's pretty vague, it's made that way so we can help people do things that are help them, remain stable, essentially.
Thank you, guys.
Yeah, and if I could chime in
Yeah.
regarding SMR. So SMR is a little bit different. Our focus isn't on housing placement. Our focus is housing assistance. So our guarantee is not that we'll find a client housing, but that we'll provide housing assistance and provide a safe discharge. So we're focused on trying to find clients somewhere to discharge safely as opposed to housing, because we're short-term program. So we get 21 days to 21 to 30 days, depending on the funder. So we're not a long-term program. So to find housing between 21 and 30 days, it doesn't happen very often. So we focus on that, and we provide, we do provide case management services where we help set up appointments, help with transportation, kind of help clients, get the hang of handling their own care, and with us providing assistance. And we do have a position specifically for housing assistants, our community support specialists, and they'll work with getting them birth certificates, IDs. They'll work with getting them info for Social Security, so that they can call and figure out the routes that they have to apply through. But yeah, that's kind of I think one of the different things about SMR is we don't focus on housing because we don't have enough time for housing. We just focus on the housing assistance and trying to get them transitioning better, leaving our program than when they came in.
And HSF has many, I mean, with all the different programs, our case managers are working with our consumers, differently in each one of them. But we are really working on like trying to figure out how to help them maintain housing. So usually we're actually helping a lot with the skills training, making sure that everything looks good for when inspections happen, stuff like that. But and that means that our staff are actually getting in and helping them like learn how to do these things. We also work with them for employment or income sources. So our team has gotten really good at navigating through helping them with interview clothes, how to interview, different resume styles, working on things such as working with like Social Security, getting them through that system, getting them through DHS for TANF, getting them through, childcare and how to get those services handled. Really just like managing their life and finding a way to balance and budget and function that doesn't feel so overwhelming all the time. And a lot of times when we get people, they're in crisis. So thinking like that is really hard. So we're able to help them see the bigger picture and like focus on each thing and like calm it down so that they can be balanced when they leave our program.
Could you each speak a little bit of how you've had to adapt for COVID-19 among your program?
Yeah. So we have, policies and procedures to follow, which include if we're going to do a home visit, if we're going to see a person at their apartment, we ask the same 3 or 4 questions that almost everyone gets asked these days. Fever, interacted with anyone with COVID. We ask them to mask up, to open up a window, and same when we're transporting people in the car. Sometimes we'll ask them to sit in the back seat, masked up, window down. We're wiping down all of our computer places, all the vehicles that we use. We've actually moved our peers out of this office so we could better socially distance. We try to alternate times in the office within the same office. So those are the major things we've done. Definitely. Of course, we have hand sanitizer anywhere you could imagine, and wash your hands a lot.
I know. So where I work, the people live in this facility itself. So here we've had to manage with the employees and the clients and making sure that everyone stays as safe as possible. Back in March, when we were first hitting the quarantine, I want to say there was 14 people who were living on site in a 16-unit facility. We were able to actually, through partnerships with other places, get that number underneath the 10 altogether living here fairly quick. We implemented cleaning regimens that are done every 4 hours, which includes pretty much any area you can sit, touch, anything that people go by. We serve food here, and that has ended up being all individually wrapped and individually served. With home visits for our scattered site clients, we have a questionnaire before we go and meet with them. In general, it's if they're sick, we can't go there. And also, if any of our employees are sick, we ask them not to show up. We have a strict mask policy that is in place every time you're not in an office doing a Zoom call. The rest of the time, everyone is masked up. Clients, it's a little bit more difficult because this is their home as opposed to the staff that are entering into it. Yeah, and then just making sure that we have staffing and coverage for when our employees aren't feeling well, to make sure that no one who is sick has to be here. That's been probably the most time-consuming part, but also the most beneficial part. We haven't had really any sick staff around the clients since the COVID crisis began. We're pretty proud of that.
At short-term housing for COVID response, we've all of our units on site that are shelter units are individual units, so everyone's able to have their own space in that manner. But we do have a shared laundry facility, so for our consumers, we've implemented going in and sanitizing the laundry facility in the morning and at the end of the day, in the middle of the day, so that that remains a good space for them. We used to have our office be open to people on site, mostly to come in and chat and have coffee and stuff, and we had to cancel that, but they're still able to come and get mail and other services at our door if they need to, in which case we ask them to wear a mask and stay 6 feet apart. As far as the staffing in the office, a lot of people work remotely, and we only have a couple of staff in the office at one time because we don't have individualized office spaces. And then obviously everyone wearing a mask in the office and those kinds of procedures.
For our team, we've changed a few things. We've definitely gone to more of an electronic or digitalized way of doing our intakes. So we do it over the phone, and we do a lot of verbal consents, except for some key pieces that we really need. And then we do that through different formats of like emails and getting them the paperwork. We do home visits, but those are limited because we are definitely working with families who, you know, a lot of our families have different needs medically. And so a lot of our families are immune compromised or some things going on to where we don't want to risk them too much. So we limit how much we see them, but we do phone calls and phone conferences on a regular basis with them. And we make sure and check in with them all the time to make sure that their families' needs are met, that, you know, their families aren't going through COVID symptoms, stuff like that. And we, you know, I mean, we definitely have stopped a lot of our transportation things because we do work with families. And so that's more than a single person in the vehicle. There's just, I mean, the difference between how it was when we originally were dealing with COVID versus now is much different. So it's relaxed a little now. In terms of how strict and how often we would actually see people. But we wear masks, we wear gloves, we ask them to do the same. We sanitize all of our pens if we have to do actual intakes. And as much as we can, we actually try to meet them outside, or I have a few of my staff that they stay in their vehicle and the consumer stays in their vehicle, and they meet in our parking lot. And it's interesting, the things that we do to make it work, but no matter what, you know, our consumers seem to still feel supported. They know that they can get a hold of us, and we're able to make it function.
I guess that means I'm left. So currently I'm stationed at SMR, and one of the things that I miss the most is we would have meal times. We'd have breakfast and lunch, and we'd get dinner. Probably my favorite time is when clients would come in. They'd come in the morning, read the paper, they'd joke around, they'd have a good time. I definitely miss that. Because of COVID, we've had to stop that, and now we call each client down by each room individually. Our staff is also on site, so we can't really work remotely because our clients are all on site as well. But we've definitely put up a lot of safeguards to kind of protect staff and clients. Our clients are coming usually from the hospital, so they are severely immunocompromised. So to protect them, we've kind of enforced them to wear masks. We have to wear masks in the office at all time, or when we're interacting with clients. Like I said, I definitely miss just being able to go into a client's room with no worry and just be like, "Hey, here, how's it going? How's your day?" But to protect them, we've kind of halted that. We still do meet with clients. We have a rec room where we can meet down 6 feet apart, masks on. We open the windows, and we're able to kind of talk to clients there. But definitely, we've just kind of adjusted a lot of our policies: cleaning, keeping safe distance, reminding clients to be. They technically live here, so you know what they do after hours is up to them. We just try to tell them, hey, for your safety and for the safety of everyone else, just make sure you're following it. Or if you're coming down, make sure you have a mask on. And it's definitely, even though it's been, I think, like 7 months, it still feels like you have to get used to it every day. But I mean, hopefully this will be over soon.
Okay, the next question that was submitted is, what is your greatest contribution to shelter care? So what is your greatest contribution to shelter care?
Um, I think that my greatest contributions to shelter care have been able to watch clients become independent. Just knowing the trusting the process and the consistency that I bring to them, and then seeing them be able to do the things that we hope that we can do, but they can do it themselves. So it's not even necessarily the actions that we have, it's just the providing the consistency and the feedback to the clients, then watching them go out and do the things that are difficult when you don't know how to do them. That's probably my greatest contribution, and really what makes me love coming to work every day.
Yeah, I would say that I think when a lot of people who don't work for shelter care think of shelter care, they think of us helping people find housing. And so to be an integral part of that is it's a cool feeling. So.
I think that it's hard to decide like what our contribution, or for me, what my contribution is to shelter care, because I don't really view it that way. Um, I'm blessed every day to be able to do this job and have grant money to, or even self-raised money to work these programs and help other people. So like for me, every day gets to be a gift because I get to help a bunch of people relieve their stress. And it's really not me per se. Like, I mean, I'm glad I'm the one that gets to do it, but I don't really see that as like my contribution. This is like a community helping a community in a way. And really that's what I love about it, is that it's not about me. It's really about helping our consumers and helping each other and like working together to build something that allows people to feel safe and secure in their homes, or know that there's hope that they can have that.
Yeah, I think the greatest contribution from staff in shelter care is really about giving our consumers hope, to be able that they deserve housing. A lot of the people that I work with, they might not have even really ever been in a rental or had like a stable housing situation in their life. And for them to come into our program and say that we're going to help support them in housing and help pay for housing and get them going in the direction there, they really appreciate that. I think that's the greatest thing that our staff can do, for ShelterCare is giving that hope, especially for the Fuse program. They usually have a lot of housing barriers to get into housing, and to meet all of those benchmarks that landlords want for tenants can be a big challenge. And so just being able to help them jump through those hoops to get into housing is a really great thing.
Okay, the next question we have is, how does ShelterCare promote and encourage diversity and equity within their staff and their clients?
I can go if
Sure.
unless someone wants to beat me to it. Personally, the way that I feel is I I obviously come from a diverse background. I'm actually Aztec, not Hispanic or Latino. I'm actually Aztec. Um, but personally, in my personal workspace and office space, I kind of feel like there's just a general respect. Our work is all so focused on, not being judgmental and not, because a lot of the times we get paperwork about clients and on paper they look terrible, and we're like, oh my gosh, like no, this is ridiculous, and we really had to get past looking past that and saying, you know what, it doesn't matter what it looks like on paper. I always like to say, I wonder what we would look like on paper and what people would think about us at a first glance. And I'm like, and that's not fair. We'd be like, hey, that's not fair. You can't just judge me off of what some paper says. And so personally, I feel like in my personal workspace, the ability for people to have different beliefs, different views, opinions, to come from different backgrounds. It's there's I've never had a moment where I felt like, hey, I can't express who I am, or I can't openly talk about where I come from, or even when our clients express different opinions or views or traditions, religious backgrounds, religious views, whatever. Our focus here has always been to respect whatever it is that they decide to follow or wherever they come from. Because again, like I said, we're not really anybody to be judging anyone, and so we really try to be welcoming. We really try to be understanding. I mean, honestly, all people are really looking for is somebody to listen, to somebody to care, and for someone to be understanding. And so we really try to push that here. It's like, we doesn't matter where you come from, what you look like, what you've done. We really are going to give you a chance to be yourself and to kind of learn to I want to say love, but I know that our clients are here for such a short time. So when we say that, it's kind of like, whoa. But to honestly love a person for who they are, regardless of their background. So,
Yeah, and I would like just to add to that too. I think all of us in leadership positions kind of understand that to be able to reach the widest uh, piece of the people puzzle is to have staff from differing backgrounds. A place like this wouldn't work if we all thought the same. Um, and so I think that's something we look for when we're looking for staff, is how do we reach the most people out there. Um,
I know that it is hard for us to really get to decide who our consumers are, because most of our consumers come from different referral sources. And so that's not something that we have a whole lot of control over. The only control we have is like making sure that people know about those resources and like making sure that that information is given to, a bunch of different places so that it reaches like a wider community. Um, and then I know that ShelterCare recently actually started up in a diversity, equity, inclusion committee, and really are trying to make sure that we are um, doing that. Like, not that we weren't already, because we were, and we recognize that we were, but we want to make sure that we're doing it conscientiously and doing it correctly so that people know that that's where it's all coming from, and that we want to be diverse and we want to be inclusive of everybody's backgrounds, and just really open up and accept, that every single one of us is a different individual. And so, like, your experience is completely valid, and your background is really important, and we want to celebrate that. We want to make sure that you feel completely comfortable.
I'm going to unofficially jump in too. With the DEI committee, we are attempting to go through our policies to really make sure they're equitable, eliminate like gender binary language, really just reviewing to make sure that they're culturally read okay. I guess they're okay for different cultures and they're not going to be taken one way or the other. We're also actively seeking trainings. If you have a training you can connect us to, that would be amazing. We are always looking for new DEI trainings for diversity. We have one coming up in December with Transponder, and they're going to come in and do a 3-hour training with ShelterCare staff on the transgender population. And any trainings like that, we're really open to them, and we'd love to connect with you. If you guys have any recommendations, you can go ahead and email them to us or toss it in the chat box. I'm going to jump to the next question. How does ShelterCare follow the Mental Health HIPAA protections and Fair Housing Act?
With the Fair Housing Act, we follow any tenant landlord laws here. We're getting referrals from Lane County almost exclusively, and we have almost no barriers. The only barriers are the ones that absolutely have to enforce are the ones that are enforced by the HUD on a federal level. Past that, for ShelterCare, we don't require like documentation. We don't require credit. We don't require criminal history. We want everyone to be housed. I suppose we're housing first. So as far as it goes with the Fair Housing Act, we really try to make sure we're paying attention to people who have needs and helping them meet those needs, and also making sure that we're not creating barriers to that people getting housed. For HIPAA here, I can say that we are working on the electronic portion. We have encrypted emails now that we're sending out. We don't give out any information for anyone without release of information forms and their express consent. And it's an active thing. We're always constantly thinking about it. We're always constantly talking about it. We have trainings every year just to make sure that we're all on the same page. And I know on our end, we're updating as often as we can as technology allows us to as well.
Yeah, and as far as the Fair Housing Act goes, I would say that as housing specialists, we spend a lot of time working both with the participant and also with a property management company or landlord. And so just ensuring that they're following all the landlord tenant laws and discrimination laws and things like that. That's really important. We definitely encourage all of our housing specialists to know their landlord tenant laws and to help our clients, access legal aid if it's needed for anything. So and yeah, obviously not releasing information without ROIs.
Yeah, and like I said about SMR, we're not housing, we're a temporary shelter. And so we regarding to the Fair Housing Act, we don't discriminate against anybody. We actually have ADA compliant rooms here, so wheelchair accessible rooms, and we have rooms with steps, and Normally, what we're really looking for when clients are coming in is we are an independent program, so we do require a little bit of independence, which means you've got to be able to walk down and pick up your breakfast and your meds. Staff is only here until 4:30 every day. So after that, the independence part is really important because we got to know you're going to be okay after we're gone. We won't come back till 8 a.m. We in the past we've kind of tried to be a little bit, less on that, and it hasn't worked out. So we try our best to not discriminate against anybody. The only thing we really ask for is independence. Just being able to take care of yourself while you're here on your own. The other thing is when it comes to HIPAA, we keep any information we have pretty locked down. We don't even share it with other shelter care locations.
Right.
If it's regarding one of our clients here, you won't ever hear about them unless I have an ROI and the client says you can share with this person or this program. But otherwise, we don't share any information with any other shelter care location unless we have the ROI. So.
For us, I mean, the other group has already talked about like how shelter care has a tendency to deal with like our landlords and stuff like that for but basically we also have like the family shelter units here on site, and those are emergency housing. So we follow the emergency housing guidelines as much as possible because we want to be fair. But they are short-term housing. They are like 30-day contracts, and you're allowed to have up to 3 of them. And as long as you're working with the program, then it continues. We do it that way because it is emergency housing, and so basically it's supposed to be you moving forward. And the only barriers that we have in that one is, the families are coming in, they're supposed to have some income and be ready to be looking for housing because we got like 90 days to get them into housing. So, I think in some ways for our emergency shelters, and I don't know about STH, but I'm sure it's the same, is there are some program guidelines that we have to follow by, but we make those incredibly clear. And there's, forms and contracts that we work with, with our consumers to make sure that they understand that it's not that we're trying to be unfair. It's these are the guidelines of the program, and that's how that program functions.
And then I'd also just like to say that as an organization, HIPAA is one of the first trainings that new employees do and is done on a yearly basis. So yeah, HIPAA's one of the first things we learn and reiterated yearly.
Okay, looks like so we had approximately 2 questions left that were submitted in the registration. One was about plans to increase available shelter, and I believe we did touch on that. We have MLK building opening in January, and that's 51 units. We always want to increase the number of units that we have. So if you're connected with landlords, we would love to connect with you because we do need to increase number of units. More units means more people can be housed.
And cost-effective units too.
Yes, cost-effective units, please. Yes, if you own units, we would love to connect with you. Otherwise, the final question that was submitted, I think I'm just going to start with Jessica. We haven't heard from you much. So how do you define success at work?
Success at work. It's a great question. For me, success at work is really working with our consumers to work on their goals and help them advocate for themselves in the community. Our services are really consumer led, and so they get to set their own goals and work towards the different things they want to work on. It could range from You know, getting connected with like senior and disability services. Could look like going out in the community and attending classes or learning more about a certain subject, or getting connected with any kind of community groups. So success is really about their success with their goals and helping them to achieve them, to be sustainable for themselves.
Are we all speaking on this one?
Yes, please.
And it's how do we define success
At work.
at work? Okay, yeah. So um the, our participant success is not our success, and their failures is not our failure either. So how do we define success, right? Can I look myself in the mirror and feel satisfied with the work I put in that day? Most times the answer is yes, and that's been a successful day. And it doesn't really matter how I feel when I go home, whether or not that day was successful. Some of the most emotionally draining days can be some of the most successful days. So it's a very loose definition.
Yeah, I think I just have to ask myself, did I give everything I had today? Like, did I do my best, even though I had a hard situation? Did I do my best to help and find a solution? Did I do my best to be patient today? Did I do my best to be a good listener? Did I do my best, to just hear my clients and listen to my clients and actually, do something with the information they gave me, or I'm trying to. So I just, I think success is a interesting word. I think we just try to do our best and try to help out our clients as best we can, even if we can't get them safe housing discharge. Um, I try to say a success, quote unquote, is that at the very least, my client left with a little bit of hope that the next social service provider they interact with will do the same that we did for them, and listen and hear them out and do something with the information and be able to build a relationship once again in the community. So
Our team talks about success a lot. And what we've learned, we have a wide variety of employees here who we all started out thinking success meant we got people housed. And what we've learned and what we strive to teach anybody walking in the door is sometimes success is getting them a step closer to housing. Sometimes that's what we need to look at success being, because our consumers have a lot of barriers, and those barriers can really, limit their options. So if we can take down one more barrier, if we can get them set up to start doing well, that is great. So for us, success a lot of times looks like they got on a list. They got rid of some of their bans, in parts of town that they needed, like the library or things like that. The things that actually, set them up for success. That looks like success to us, and it can be something incredibly small, and as long as that is them doing better, and we were able to facilitate that, even if it's just one person that day, that is amazing, and that's what we're trying to do, and that looks like success for us.
Yep. All good words. We also have like contractual obligations and stipulations that we have to meet, just so that way there are benchmarks to objectively measure success. But those are just things we make sure we're doing. The actual feeling of success comes from, again, I think I touched on it a little bit earlier, is seeing someone do something independently that had been a problem area that they'd identified before. This is like, it doesn't have to be a completion of of any one goal. It can just be seeing these steps taken towards it and seeing them taken in a way that's meaningful and sustainable for the clients. And that's just, it's super awesome when you see that. You know that you're creating an actual change as opposed to just, pushing someone forward.
Well, I want to say thank you, everybody, for being here with us today. A shameless plug for our 50th anniversary again. Our auction opens tomorrow, Thursday. I hope tomorrow's Thursday at 7 p.m. and closes Friday at 7 p.m. And also, if you have any questions that we did not get to, you're more than welcome to email us at development, DEVELOPMENT @sheltercare.org, and we will make sure that those questions get answered. Once again, thank you, and thank you for our panel. We really appreciate you guys taking the time out of your day and talking to all of us.
I want to say thank you to the staff for excellent presentation, very informative. You all really were very articulate, and I really appreciate all your hard work. So this is Sandy Sheets as a member of the board, but I really enjoyed today's presentation. So thank you all.
Thank you.
More than happy to do it.
Thanks, everyone. Have a great rest of your day.